My name is Jim Young. I just recently had hip replacement surgery at Cooperman Barnabas Medical Center, performed by Dr. Yoon. It started off as a slow pain, meaning it was difficult to get around. There was an ache in my hip and groin area. And as time went on, the pain became almost unbearable. I couldn't tie my shoes, I couldn't put socks on, I couldn't bend over. I'm an avid golfer. I was having trouble playing golf and walking, so I decided to seek out help. Prior to working for Cooperman Barnabas, I was a police officer. Was home for a year or so and got a little tired of just sitting around. There's only so much you could do around the house. So I took this position at the Ambulatory Care Center. I met Dr. Yoon here at the Ambulatory Care Center.
When Jim came in, he asked what his options were. Obviously, conservative measures are always an option. Therapy, anti-inflammatories, even an injection is a possibility. However, his arthritis was so severe, we knew that all of that would only be a temporizing measure.
He immediately sent me down to the x-ray department for x-rays on my hip, my right hip. The x-ray showed I was bone on bone and I was causing a lot of discomfort, and it would not get better without surgery.
And we went over the traditional posterior versus the direct anterior, and for his goals of wanting to get back to work and being ready for the upcoming golf season, we elected to do a direct anterior approach for rapid recovery and rapid muscle sparing surgery.
I woke up sometime later, it wasn't a long time, in recovery, absolutely no discomfort, which really surprised me. After I was fully awake and my vital signs were good, they took me to a room because I had to spend the night. I was off work for about 3 months because some of the work I do is physical, so I had to make sure I was fully healed. And then after that, I came back and saw Dr. Yoon for a checkup. I was then given a prescription to go to regular rehabilitation for my hip, and I chose to come here to the Ambulatory Care Center, and I did rehab 3 days a week here. Golf is the only hobby activity that I really enjoy. By, I'd say 4 months, I played golf for the first time. I took it easy. I rode a cart. I was pain-free the whole time, and I've been playing about twice a week ever since, with no problem whatsoever. Surgery was the best idea and cause for me. Dr. Yoon, in my opinion, he's had a number of other orthopedic procedures on me. Obviously a great surgeon and extremely personable. Since my surgery, I guess it's 5 months, 6 months now, I have a normal activity. I go to work every day. I do part of the day walk through the facility. I have absolutely no difficulties walking, bending. So in all, I highly recommend the hip surgery if you need it, if your surgeon tells you you need it, and more so, I highly recommend Dr. Yoon.